All right, Toy, the state health officer, Scott Harrison, saying yesterday Alabama has tested less than 20 people for the novel coronavirus. So how does that compare when you look at other states? And why has the testing been so limited? Our investigative reporter Brendan Kirby digging for those answers. He is in the newsroom with what he found. Brendan.
Lenny, state public health laboratories have conducted more than 4,800 COVID-19 tests nationwide. Most only have been testing a week or so. Testing has varied. Florida, for instance, reports conducting 476 tests, with 28 positives, 301 negatives, and another 147 still pending. On the other side of Alabama, though, Mississippi has conducted just 20 tests, all of them negative. Randy Murphy, an epidemiologist at the Mobile County Health Department, says she understands why people think testing should be more widespread.
It does seem like a low number, particularly considering all the hype we are seeing around the U.S. But remember, right now we're trying to prioritize testing for only the people that are at highest risk and are sick, or the people that are the sickest and we're not sure why they're sick.
Test kits remain in short supply, and Murphy says all states are following the same guidelines, limiting tests to people who are experiencing symptoms of the virus and who have traveled recently to an area with a high number of infections. In Alabama, bureaucracy also is colliding with the high state of alert that the coronavirus has caused. COVID-19 isn't among the infectious diseases that are required to be reported to health authorities, and State Health Officer Scott Harris told reporters Tuesday that's simply because it's new.
We have a process for amending that rule that allows us to make something notifiable, and like all rule processes, it takes 2 or 3 months and public comments and the whole administrative rules process.
The department has issued an emergency rule to fix that temporarily while officials seek a permanent change. Murphy acknowledges the absence of confirmed cases doesn't guarantee that the virus isn't already here.
It's likely, and perhaps we're not detecting it because we're not able to test everyone. But we have a good public health system and a public health response in place. You know, it was the public health system that identified the first cases in Washington and in California.
Commercial labs also have begun to test for the virus, but under current rules, only those testing positive have to be reported. So we likely will never know the total number of people tested but deemed virus-free. Reporting live from the newsroom, Brendan Kirby, Fox 10 News.